Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist. And happy April, or should I say, happy OT month or Occupational Therapy month. So I thought that why not celebrate this awesome profession and my field and what I studied in school by sharing a little bit of that with all of you, because one of my probably top 3 questions that a patient will ask me is, what's the difference between occupational therapy and physical therapy? Or alternatively, what is occupational therapy? So I'm just going to share a little bit about that and give you some information so that you can find out more. And if you're interested in becoming an occupational therapist, it's a great profession with a lot of really cool settings and variability and just really rewarding career that you can work in. So yeah, let's get into it. So first, what the heck is occupational therapy, or OT? I actually pulled up a definition from Wikipedia, which is actually pretty decent. So this is how they define occupational therapy. Occupational therapy is a healthcare profession that involves the use of assessment and intervention to develop, recover, or maintain the meaningful activities or occupations of individuals, groups, or communities. So that's actually a pretty good definition in my book. OTs work with people of all ages throughout the lifespan in a variety of settings, and we work with people to help them get back to their occupations, not just jobs, right? But meaningful activities, things that you want to be able to do, that you need to be able to do to get through a day. That can include anything from getting out of bed, getting dressed, being able to, button buttons or zippers, being able to do grooming and hygiene tasks, activities of daily life, meal preparation, getting to work, doing activities that involve your work tasks or your hobbies, or getting around the community, shopping for groceries, like really any activity OTs can help with. So currently in the US, occupational therapy is a required master's degree. A lot of schools are actually transitioning towards doctorate degrees, which is true of the school that I went to. So I am a Master of Occupational Therapy. I went to the University of Pittsburgh in Pittsburgh, Pennsylvania, and it was a great school. I loved my classmates and my experience there. And when I went there, it was, I think, the number 3 school for occupational therapy in the country, and it's actually ranked first this year. So go Pitt. Little plug there for my Pitt Panthers. And they now don't offer a master's degree. I believe they transitioned to a doctorate in OTD a couple of years after I graduated there. So I kind of just squeaked by through the master's program. And I'm really glad that I was able to get through that. It was everything that I needed to be able to get to my career in hand therapy. So I'm a certified hand therapist, so that's my setting. I work in outpatient care. I work with patients with upper extremity conditions. I don't have experience with any of the other parts of the body. I've been out of school for, is it 7.5 years now? 8 years? I think it's been about 8 years since I've been out of OT school. So, when you kind of go into a niche, you sort of forget everything else. But luckily, I love the field that I'm in. I love what I do, and I love learning about what I do. But that's not the only setting that OTs can work in. OTs work with people throughout their lifespan, from people from birth, right? NICU setting, pediatric setting, all the way through the lifespan to end of life. And OTs can work in outpatient, inpatient. They can work in the ICU or acute care. They can work in mental health settings, pediatric settings. You can work as a school-based OT. You can work in home health, where you go around the community and you go to people who are homebound and help them. You can work in ergonomics. You can work in community areas, just skilled nursing. I'm forgetting all of the options because there's so many, right? I truly believe OTs can do anything. We will rule the world one day, even though nobody knows what we are and everybody just calls us physical therapists. But yeah, we can literally work in any setting, be really creative. It's great and rewarding to be able to help people actually function and be able to do what they need to be able to do. So it's a pretty cool profession. I'm going to link some information below. I'm going to plug, obviously, University of Pittsburgh, where I went to go to school, but there's tons of great universities for occupational therapy. I'll link below the AOTA, American Occupational Therapy Association, so you can learn more about OTs and what settings they work in and what services they provide. And then I will also link the Hand Therapy Certification Commission, HTCC website, which if you are interested in looking into becoming a hand therapist, or you want to know more about hand therapists or find a hand therapist in your area, that is a great website to go to. So yeah, now you know a little bit more about occupational therapy. Maybe you know or have a basic understanding of what an OT is and what they aim for. So remember, functional activities of daily life. OTs are going to help you be able to do the meaningful activities to you. And now you can be one of the 5% of people out there that can impress your OT or PT when you say, I know what an occupational therapist does. Because seriously, so many people don't know what that means, which is totally fine. But go out there, spread the word, and ask any questions that you want about OT, hand therapy, anything that you can think of in the comments below. I hope you enjoyed this video. Thanks for sticking with it. Happy OT month, happy April, and I will see you in the next one.